Welcome back in. We want to focus in on an important issue this morning. It is Black Maternal Health Week, and recent CDC data shows maternal mortality rates dropped for everyone except Black women in the U.S. Black women are 3 times more likely to die from pregnancy-related complications than their white counterparts. And in Montgomery County, a new report reveals that number is 50% higher than the national average. Joining me now to talk more about this is Montgomery County Councilmember Lori-Ann Sales. Thanks for being with us. I appreciate it.
Of course. Thank you for having me.
This is it's such an important topic.
Yes.
You all recently had a report that was released. You asked for this. Talk about the reason you wanted to see the numbers specifically from Montgomery County.
So Montgomery County has over 1 million residents. We have 4 of the most diverse cities in the country. And when Roe v. Wade was overturned, just a few months before I was elected, it was important for me to find out who would be most impacted by those decisions and how that would impact maternal health overall. And Black women are usually at the top of some of the worst lists of disparities.
Yeah.
And this report shows some startling disparities. Black women are 5 times more likely to die during childbirth than any other demographic. And so it's very unsettling as a Black woman who represents this community. And now that we have this information, it's very important that we actually look at policies that can improve outcomes, and quite a few recommendations that we can implement and put out to ensure.
Yeah, but before we get into those, I just want to get your reaction to that. I think for people who may be living through this, these numbers may not be a surprise, but what was your reaction as this report was released and these numbers were released?
We are at the nexus of, as you mentioned, Black Maternal Health Week, Public Health Week, Minority Health Month. The results were startling, not necessarily surprising. We know that communities of color who are most impacted by systemic racism, bias in the healthcare system, face considerable health outcomes that are unfavorable. And so seeing the numbers, some of the statistics that we saw just in Maryland, how many pregnant women are forced to get C-sections. Black women are getting C-sections at a much higher rate than any other demographic. And we know that the disparities that are associated with C-sections, from blood clots and further complications down the line, further impact women in future pregnancies. And so when we saw that the numbers for Black women were at significantly higher risk for severe maternal morbidity from hypertension, preterm birth, low birth weight, we knew that we needed to do incredible things to ensure that we changed those outcomes.
Yeah. And talk about what the plan is now. You have this report in your hands.
Yes.
It's not a good report by any means. So what do you as a county leader want to do, and hopefully with your colleagues, to try to change things for the better on the local level?
We have to take the recommendations and turn those into policies. Some of the recommendations are things that are things that we can quickly implement, from increasing and expanding access to diverse health care providers, integrating doulas into our existing maternal health programs, investing in community-driven solutions. Black women need to be at the center of their health care delivery. They need to be listened to, and we need to ensure that we are working across strong equity guidelines, working closely with community-based organizations. We can no longer work in silos when we're losing support and institutional knowledge at the federal level, and protections and, health care insurance support.
Yeah. And talk about that a little bit more, because there are great organizations in our community like Mama Tota Village, so many others too. How do you all plan to, better partner with them to make those relationships stronger?
You know, in Montgomery County, we have health initiatives like the Babies Born Healthy programs. And I was just speaking with a group of pregnant mothers and mothers who just gave birth and who are feeling these fears about carrying their babies to term, and fears about what's going to happen in the delivery room, when they feel pain, when they don't feel like they have the support that they need. And being comfortable with speaking up and encouraging them to be proactive in communicating any discomfort or any concerns that they have. Taking the Lamaze classes and advocating for the doulas. We don't have enough. We know that we need to train and deploy more doulas so that mothers can have that pre and post-term support. We know that some of the most critical moments are during labor and delivery, but immediately after. And so that really impacts the longevity and ensuring that mothers bring their babies to term and survive childbirth in this modern day.
Because we know 80% are preventable. 80% of maternal deaths are preventable. I really appreciate your time and your insight on this. And I know you said earlier, let's not just stick this report back in the drawer. Let's make some changes.
Let's make some changes.
We're looking forward to that. Councilmember Sales, thank you so much
for having me on this important topic.
All right, we also want to talk about another important event in DC for Black Maternal Health Week, a screening of the short film Push. That is happening Thursday, April 17th at 5 p.m. at Vital Voices headquarters. It's in Northwest. The film highlights the Black maternal health crisis and the need for change.
A 7-minute provocative film, and it is about a Black family who is about in their 3rd trimester, and they're about to give birth, textbook pregnancy, and at some point the mother doesn't feel the baby anymore. And so it bodes to what Push is pushing for, because between 27 to 40% of pregnancies, stillbirths, are preventable. And so this mother is no longer feeling her baby. And this is where the juncture comes in of when she calls her healthcare team and what is their reaction. And so it's a kind of dual reality of what can happen when your doctor and your healthcare team creates an alliance with you and when they don't.
And Push for Empowered Pregnancy, a stillbirth prevention organization, is part of this event. Marjorie Vale, who you just heard from, she's a co-founder of Push. And maternal health, this is a topic that is deeply personal to her. Her son, Alexei, was born still at 37 weeks. Vale's sister also died from complications after delivering her baby. There will be an important panel discussion after that screening on Thursday, and I just put a link up on my social media pages on how you can RSVP. We'll be right back.